Prostate enlargement, also known as benign prostatic hyperplasia, BPH, is a prevalent issue among men, particularly those over the age of 50. This condition can lead to difficulties with urination, frequent urges to urinate, and discomfort or pain in the pelvic area, lower abdomen, and the region between the scrotum and anus. So, what exactly is happening in your body? As shown in this image, the prostate is a small gland located just beneath the bladder, which stores urine. Urine flows out of your body through a tube called the urethra. When the prostate becomes enlarged or swollen, it exerts pressure on the urethra, the tube that connects your bladder to the outside, leading to a range of issues. The swelling prevents urine from flowing freely, causing a backup and trapping liquid in your bladder. This can lead to poor bladder control, especially at night when you're trying to sleep. You may feel a sudden, urgent need to urinate, but only pass a small amount of urine. You might also notice that your urine stream is weaker than normal, and could stop and start during urination. In some cases, you may have to strain or push to even begin urinating. Research shows that prostate enlargement can be triggered by hormone imbalances in the body, including elevated levels of hormones like estrogen, insulin, or DHT. Unfortunately, some foods are known to promote these hormones, further contributing to prostate swelling and heightening the risk of prostatitis infections and even prostate cancer. In today's video, we'll be sharing the top 6 foods you should avoid if you're dealing with prostate enlargement. We'll also provide a few simple lifestyle tips and remedies that can help reduce the size of your prostate and improve your urinary flow. Keep in mind that this video is intended for educational purposes only, so be sure to consult with your doctor if you have any health concerns. Let's dive in. 1. Alcohol. Alcohol consumption can significantly impact your body, particularly the liver and hormone levels. It acts as a solvent that damages hepatocytes, the liver cells responsible for metabolic processes. This damage can lead to hormonal changes such as elevated estrogen and insulin levels. High insulin levels can contribute to prostate enlargement, benign prostatic hyperplasia or BPH, while increased estrogen exacerbates prostate issues. Additionally, excessive alcohol intake can raise blood pressure and weaken arteries and blood vessels, complicating prostate health. Beer, in particular, is known for its estrogenic effects, which can intensify hormonal imbalances. To support your prostate health, consider reducing or eliminating alcohol from your diet. Instead, try incorporating 1 to 2 cups of kombucha tea into your evening routine. This fermented tea provides a refreshing alternative and offers various health benefits. The probiotics in kombucha promote a healthy gut microbiome, aiding in detoxification and supporting liver function. 2. Processed meats. Processed meats include foods like salami, hot dogs, canned meats, pepperoni, and ham. Unfortunately, these are meats that have been processed and mixed with all kinds of chemical preservatives, nitrates, dextrin, sugar, soy proteins, and vegetable oils. Studies show that processed meats can increase the risk of cancer because of how they cause oxidative damage to the cells and form sticky proteins that clog up your arteries and cause blood clots. By damaging your liver, they also raise the risk of developing prostate cancer and make existing prostate problems worse. Cut out the processed and conventional meats and start eating higher quality meats from local farms. Ensure that your meat is grass-fed, grass-finished, and organic. This will ensure that no hormones or junk foods were fed to the livestock, and grass-fed meat is much higher in nutrients and will not contain the harmful chemicals added to processed meats. Grass-fed beef and organ meats like liver are packed full of zinc, heme iron, and proteins that support a healthy prostate gland and help produce seminal fluid for reproduction. Please remember that everyone has a unique body and biochemistry, so it's important to trial and error by removing foods from your diet and noticing if your urinary or prostate problems improve. 3. Unfermented soy. Cheap, inexpensive soy proteins are being added to many foods. Soy protein isolates and soy powders are often added to diet shakes, ready meals, vegan meat patties, protein bars, baby formulas, and processed meats. Soy protein isolates cause a massive increase in insulin in the body, an anabolic hormone that can make BPH, prostate enlargement, and LUTs, urinary problems, worse. Soy powder also raises estrogen, another hormone that can cause prostate enlargement in high amounts. Soy is also GMO grown in the presence of chemical pesticides, herbicides, and insecticides, which are hormone disruptors and endocrine disruptors. Finally, soy is rich in phytic acid, a chemical that can block your body's ability to absorb minerals like zinc, which are needed for normal prostate function. So if you have any prostate issues at all, cut out all unfermented soy products. 100% organic fermented soy foods like miso, soy sauce, tempeh, and natto are fine. The microbes used in the fermentation process help to remove the harmful effects of soy, making it much healthier for the body. 4. Sugar. Whenever you eat refined sugar, flour, grains, or starch, your body quickly converts them into blood sugar, glucose. This can damage your cells very quickly, especially if you eat a lot of sugar in one sitting. To prevent damage, your body releases insulin, a hormone that takes the sugar out of your blood and puts it into your cells to make fuel and energy. The problem is that when you continuously consume refined sugar and foods that turn into sugar, your pancreas pumps out more and more insulin. Insulin is a growth hormone, so high amounts mean you need to urinate more often, especially when you're trying to sleep at night. Start cutting down on your sugar and carb intake from fruit juices, sweets, biscuits, pastries, bread, sodas, cereals, and flour-based foods. Stop eating after 7 p.m. and allow your blood sugars to stabilize. You'll soon notice that you'll need to pee less, and you'll get a much better night's sleep. 5. Vegetable oils. Most of the common cooking oils are made from highly processed and GMO grains like soy, corn, cottonseed, canola, grapeseed, and rice bran. Contrary to the name, these oils do not come from vegetables. Vegetable oils are used in fast foods, ready meals, deep-fried meats, store-bought salad dressings, margarine, and coffee creamers. These oils are rich in inflammatory omega-6 fatty acids, which can trigger massive amounts of inflammation in your prostate gland and especially in your liver. Your liver plays an important role in balancing out your hormones and filtering out excess hormones that you don't need. But when you weaken the liver by eating these refined oils, hormones like estrogen and insulin start to build up in the body and cause the prostate to grow, and the walls of your bladder lose their tone and become weaker. Start cutting these out of your diet and cook your own healthy meals at home using extra virgin olive oil, cold-pressed avocado oil, and organic raw coconut oil. We also suggest eating more omega-3 rich foods like oily fish, salmon, sardines, and pasture-raised eggs. These are anti-inflammatory and will counter any damage from eating too many vegetable oils, omega-6. 6. Dairy products. If you're experiencing issues with urination due to an enlarged prostate, it may be beneficial to reduce or eliminate dairy products from your diet, including butter, cheese, milk, yogurt, and cream. Dairy foods derived from cow or goat's milk contain natural growth hormones such as prolactin and insulin-like growth factor 1, IGF-1. While these hormones are essential for the growth of infant animals, they can irritate an already enlarged prostate. This irritation may cause the gland to swell further, increasing pressure on the urethra, the tube that carries urine out of the body and bladder. For individuals without prostate issues, dairy can be a nutritious part of the diet, offering valuable nutrients like calcium and protein. However, if you're dealing with benign prostatic hyperplasia, BPH, it's worth experimenting with a dairy-free diet for 1 to 2 weeks. Pay attention to any changes in your symptoms during this period. You may find that cutting dairy helps alleviate discomfort and improves your urinary health. Making this dietary adjustment can be a simple yet effective step toward better prostate health. Later in the video, I'm going to share with you 6 lifestyle changes and remedies that you can use to help shrink your prostate back down to its normal size. But first, let's take a closer look at what causes prostate enlargement so you can really understand what's happening in the body and why these remedies are so important. One of the most common causes of an enlarged prostate is poor diet, specifically the consumption of too many refined foods. Foods high in sugar, processed grains, and refined flour can deplete the body's reserves of essential minerals such as zinc. Zinc plays a critical role in regulating hormones like testosterone and dihydrotestosterone, DHT. When zinc levels are low, the body may produce higher levels of DHT and other hormones like insulin and estrogen, all of which can contribute to the enlargement of the prostate gland. Additionally, being overweight is a significant risk factor for prostate enlargement. Excess body fat, particularly around the abdomen, leads to higher levels of estrogen and insulin, both of which are linked to the growth of the prostate. Studies have shown that men who are obese are more likely to experience BPH, as well as more severe symptoms. Another factor contributing to BPH is the body's decreasing ability to absorb essential nutrients as we age. As men get older, stomach acid production tends to decline. This reduction in stomach acid can impair the absorption of critical nutrients like zinc and magnesium, which are necessary for maintaining prostate health. Without sufficient levels of these nutrients, the body may struggle to regulate hormone levels, leading to an increased risk of prostate enlargement. The final and one of the most important factors is inflammation, especially chronic inflammation, which can damage prostate cells and tissue over time, causing them to grow uncontrollably. In the next section, I'll outline 6 simple lifestyle changes and remedies that can support your prostate health. Eat more zinc-rich foods. To support your prostate health, it is crucial to consume adequate amounts of zinc. This essential mineral plays a key role in hormone regulation and helps prevent testosterone from converting to dihydrotestosterone, DHT. To increase your zinc intake, focus on incorporating foods like pumpkin seeds, oysters, grass-fed beef, chicken, and lentils into your diet. If you feel you may not be getting enough zinc, consider discussing supplementation with your healthcare provider. Supplementing with a high-quality zinc supplement can help improve your symptoms and overall prostate health. Exercise regularly. Maintaining an active lifestyle can significantly benefit your prostate health. Regular exercise helps reduce body fat, which can lower estrogen levels and improves insulin sensitivity, making it easier for your body to regulate hormones. Aim for a combination of aerobic exercises, such as walking, jogging, or cycling, along with strength training to build muscle and improve overall health. Even small lifestyle changes, like taking short walks during the day or incorporating more physical activity into your routine, can have a positive impact on your prostate health. Stay hydrated. Drinking plenty of water is essential for maintaining optimal urinary function and prostate health. Staying hydrated helps flush out toxins and waste products, reducing the risk of urinary tract infections and supporting kidney function. Aim to drink at least 8 8-ounce glasses of water daily. It may also be beneficial to limit caffeine and alcohol intake, as these can irritate the bladder and exacerbate urinary symptoms. Reduce stress. Chronic stress can negatively impact hormone levels and contribute to inflammation in the body, which may worsen prostate health. To combat stress, practice relaxation techniques such as deep breathing, meditation, yoga, or spending time in nature. Engaging in activities that bring you joy and fulfillment can also help reduce stress levels and support your overall well-being. Incorporate anti-inflammatory foods. A diet rich in anti-inflammatory foods can help reduce inflammation in the body and support prostate health. Include foods like fatty fish, salmon, mackerel, leafy greens, spinach, kale, berries, nuts, and seeds in your diet. These foods are high in omega-3 fatty acids, antioxidants, and fiber, which can help combat inflammation and improve overall health. Consider herbal supplements. Certain herbal supplements may support prostate health and help alleviate symptoms of BPH. Saw palmetto is one of the most well-researched herbs for prostate health and may help reduce urinary symptoms associated with an enlarged prostate. Other herbs like pygeum and stinging nettle may also provide benefits. Before starting any new supplements, consult with your healthcare provider to ensure they are safe and appropriate for your needs. Thank you for watching. If you found this video informative, please consider giving it a thumbs up, sharing it with others, and subscribing to the channel for more health tips and insights. Remember to take care of your health and prioritize your prostate health by making informed dietary and lifestyle choices.